Yes, thanks a lot, Tara. Linda did a fantastic job of talking about how we start to rebrand climate change to be an issue about people's health and about equity and justice. And so in that larger narrative, the healthcare sector has a unique role to play compared to any other sector of the economy. Because it's the one sector of the economy that has healing as its mission. And it's underpinned by this ethical framework to do no harm. And so, Linda mentioned it, but there's three fundamental roles that healthcare can play here. One is around resilience. And so what we've learned from Sandy and Katrina and every other climate disaster around the world is that you need the healthcare infrastructure to be resilient and in place to be able to address the public health impacts related to an extreme weather event. And so it needs to harden its infrastructure so that it can operate when the grid is down, so that it may be the one place in the community that has clean water when the rest of the community's water may be contaminated by flooding. And so that's one fundamental role, and we've developed a framework for the Department of Health and Human Services about how hospitals can change their infrastructure, their transportation, their supply chains to address the idea that they need to be the first responders. They can't fail in a climate emergency, so that's one role. The second role, which I'll talk about in a minute, is about mitigation. And so the other part of this is that healthcare in this country is almost 20% of the entire economy. The only thing that's bigger than healthcare is the military. And so healthcare has this outsized catalytic role to address climate change as part of its mission, to change its energy source, to localize more of its purchasing, especially around food, to change its transportation in ways that can drive the economy toward low-carbon solutions, and that they can lead by example and show us how to make this transition from our addiction to fossil fuels to a more healthier economy based on renewable energy. And Eric's going to talk about a couple of solutions in that regard. And then the third role, which Linda referenced, is as messengers. As we change the narrative around climate change to be about fundamentally people and their health and their communities, it gets out of being an environmental issue, and healthcare leaders are some of the most respected people in our society to help to advocate for policies that are going to have the co-benefits that Linda talked about. So I just want people to hold those three buckets of kind of roles that healthcare can play, because I think as anchors in our communities, they can exercise each of those roles, which will have a very powerful impact. So, Eric.
Hi, my name's Eric Lerner, and I work in Healthcare Without Harm as the Climate Director. So I'm going to talk about what we call green employee benefits and how we look at them as a vehicle to work with hospitals to help them decarbonize their employees. And I just wanted to do a quick disclaimer, because all good presentations start with a disclaimer, that I've spent most of my adult life working in the labor movement. So I'm still learning about environmental sustainability and climate change. And I am by no means an expert on energy issues, and for those of you that are experts, welcome feedback on my presentation on how we can make this program more impactful and more green. So as a starting point, October 2014, there was an article in the New York Times called Home Solar Power Discounts Are Worker Perk and New Program. So it's about, the article's about companies that work within a program that qualify their employees for discounts to build solar panels on their homes. And our reaction to this was, wouldn't this be intriguing for hospitals? It syncs to the mission of hospitals around keeping people and communities healthy. Many hospitals already have employee engagement programs that deal with sustainability. So this is an interesting match that we wanted to look more closely at. So our next step was to do some research. And the first company that we talked to was the World Wildlife Fund. And they were really a driver in terms of creating this program. And it turned out that they had issued an RFP for a national solar aggregator and had selected a company called GeoStellar And one of the great things about that was we wouldn't have to do that work because someone else had already done it. We started to also talk to companies that were involved with the program, Cisco, 3M, National Geographic, the City of Cleveland, and they had really positive things to say about the program. It was low cost for them, it was easy to administer, employees liked it, and they felt like they were having an impact. So next, early in the summer, I was on a conference call with sustainability directors from hospitals. And the sustainability director for Cleveland Clinic said something that was really impactful, which is the next slide.
Gary, can you mute?
And just to read the quote, which is from John Utek. The total energy used by Cleveland Clinic employees for their personal energy needs is as great as that used by the entire Cleveland Clinic health system. So this made us think that we're spending a lot of time and energy working with hospitals on how they can transition to renewables. We're working with them on employee engagement strategies to help their employees be more sustainable at work. And we're also working with hospitals on how they can be more energy efficient. And this seems like an incredible opportunity to engage with the workforce around climate change, but not in the atmosphere of their homes, but in terms of their personal energy use. And also to note that Cleveland Clinic has over 30,000 employees. So when you start talking about a lot of health systems participating, we're talking about very, very, very big numbers. Next slide. So we were at the point where we wanted to test it out. And in the summer of 2014, we started to organize something called the Healthcare Climate Council. And the idea of the council is to bring the best and brightest health systems from across the country together who really cared about climate change to help us create a collective national voice to address climate change. Today there are 15 health systems that are in the council, representing over 400 hospitals with annual revenue of over $100 billion. And these little red flags are the hospitals that are represented on the council. And so our first step was we wanted to look at the council members to pilot the program. And today we have 7 of the council members that have either signed MOUs with GeoStellar or in the process of signing MOUs with GeoStellar. And those will be the companies that kick off the program, the hospitals that kick off the program. And so we're going to pilot it with members of the council. What we want to do is create case studies. We want to get some favorable media. We want to work out the kinks in the program. And then open it up to our network of 1,300 hospitals that we work with to be more impactful. And one of the things I wanted to also lay out, that GeoStellar, while they're a national company, that the solar installing that they're going to do is with local companies. So there's also a local green jobs program that's connected to this that was really, really important to us. And just a flavor of some of the hospitals and health systems that make up the council. So we have Cleveland Clinic, who's a world-renowned health system, a sustainability leader that's also located right in the heart of coal country. We have Dignity Health, which is the 5th biggest, largest system in the country. They divested from tobacco. They're considering divesting from fossil fuels. As a Catholic system, they really look at the Pope's encyclical as a call for action. So they're a really important member of our council. Gunderson Health, based in Wisconsin, they divested from fossil fuels. This summer, they declared energy independence because of their commitment to renewables. And they are another really great active leader. Hackensack University Medical Center, what's interesting about them, Hackensack, New Jersey, is they were right in the center of Hurricane Sandy. And so they had really important experiences to reflect on of what that meant in terms of keeping their hospital open and really working with the community in a way where they could be a system that that folks could look to help deal with the impacts of Sandy. Kaiser Permanente really sets the standard on environmental sustainability, and as some of you may know, earlier in the year, they made a massive renewable buy that will allow them to run half their California hospitals on renewable energy. And then Partners Health, which is based in Boston, one of the biggest systems on the East Coast, and they've made an incredibly strong commitment to climate resilience and specifically sea level rise. based on the need to keep their facilities open as we hit extreme weather and deal with sea level rise. So I wanted to give a little bit more definition to what we mean by green employee benefits. I'll just read the slide. So green employee benefits allow hospitals to engage with employees on actions to address climate change while creating opportunities for hospitals to demonstrate climate leadership. Green employee benefits can facilitate behavior changes with results that employees can see and which also measurably benefit the environment, have the potential to accelerate meaningful climate impacts and bring sustainability values deeper into the fabric of an organization. They provide services to help retain and attract employees, as well as benefit their health and financial well-being. They afford health systems the opportunity to demonstrate and develop their climate leadership. And a couple of other green employee benefits that we're looking at initiating. In early 2016, we want to develop a green employee benefit that would provide fossil fuel retirement options for hospital employees. And then we are starting to work on a green employee benefit around transportation, which is one of the biggest producers of greenhouse gases. So this all sounds good and impactful. We are excited about the potential development program, but the reality is there's some real restrictions and limits based on how the program is currently structured, which it appeals to a limited group of hospital employees, which are those that have homes where the sun shines and who have the resources to be able to buy solar for their homes. So that segment of the workforce tends to be more white. Professionals probably live in communities that are healthier, and it's an important group, not to discount them, but we really want to develop the program so that more hospital employees can plug into it. So one thing that we'll do, which still really focuses on homeowners, is to create power purchase agreements, where instead of having the down payment to have to buy solar panels, you lease them. So it's much more affordable, and you also get the benefits of inexpensive or affordable green energy. The other thing that we're looking at doing is, or I guess I'd say the kind of real home run on this, is how we connect renters to this program. And we think the long-term solution to that is hospitals being able to finance and develop renewable energy projects. And an example of that would be community solar. And Kaiser is actually very close to figuring this out. And the vision that we have is where the health system becomes the marketplace for selling affordable green energy to employees and community members. That is where we want to get to. But as a current step, because we're not ready to really develop the piece where hospitals are financing these projects, we're looking at renewable energy credits. And I know in some circles those are controversial. It's seen as greenwashing or kind of the old-fashioned strategy. But we've identified a partner that tells us that they're different. And I was going to read from an email that they sent for those of you that are thinking, oh, this is bad. And the name of the company is Arcadia Power. And the email that they sent says, Arcadia Power buys clean energy from partner wind farms to match participating employees' exact monthly usage. This certifies that an equal amount of energy that employees consume is produced and put into the grid from pollution-free renewable facilities. We only buy green E-certified renewable energy credits from new wind farms. These go directly towards supporting new wind projects put up by active and progressive wind developers who therefore can reinvest and build more wind turbines and put more renewable energy into the grid. And if you sign up for this, Arcadia Power pays the participating employees' local utility bill, and then they send you a different bill, which I think is about 3 to 5% over the cost of what you would normally pay. And that's the kind of short gap measure. The best one that we can figure out now is a way to connect renters to this program. And renters, right, that is, right, think about who those are. That's going to be the housekeepers. That's going to be the security officers. That's going to be the folks that work in food service, the folks that live in poorer communities, the communities that have high asthma rates and other environmental issues. So that, as I said, is the prize and where we want to get to. And the next slide is just a flyer about with some background information about Arcadia Power. I guess one other thing I wanted to add is We are creating right now a web-based landing page with GeoStellar. And this would be the place that every hospital employee in the country whose hospital signed up for this program would go to. And what it would do is provide background on the information, on the program. It would provide educational resources on climate and health issues. And then you put in your address, and it gives you an instant profile for the solar capacity of your home, how much you would have to spend for the recommended number of solar panels, available rebates at a national, state, and local level, financing options. And then what it would do for us is provide data on how many employees are signing up for the program, buying solar, the capacity, the solar capacity that's being generated, and then how much carbon pollution is being reduced. And as we know, funders really like metrics like that. So that's really important to collect that data. And I would just say in conclusion, we have pieces that we have to build into this program, but if you think about the ability to scale this and really touch what's maybe close to 1 million hospital workers, hundreds and hundreds of thousands, and we can enlarge the kind of the menu of items that allow them to connect to this, we feel like we can have a really significant impact on hospital employees decarbonizing. Thanks.